I thought it'd be interesting to hopefully help some of you that have maybe gone through something recent where your vet is recommending your animal be put on a special diet. Prescription diets are a huge thing in veterinary medicine. There are a ton of them and a ton of different ones, and they are for almost any medical issue you can think of. There's probably a prescription diet for it. So I just thought we'd kind of go over some of the most common ones, and especially the ones we use the most in animal shelters, and some of the things to think about when your vet is recommending that your animal be put on a special diet. There are a couple other brands that are starting to get into prescription food. The two major brands as of now are going to be your Royal Canin and then Hill's. Royal Canin has their own prescription diets and things like that. Hill's is probably one you see more often because they make basic diets too, called science diets. So they'll have like regular dog food, regular puppy food. So it's not a prescription, it's just better quality regular food. There might be one over another that your animal prefers. So I originally tried Hill's for Luna and she didn't like it. So we switched to Royal Canin and she likes that better. Do know that there is that kind of little wiggle room. A lot of diets too will have different flavors. If you are looking for wet food, they might have like a pate versus like a stew, depending on what kind of diet it is. So there are, differences that you can kind of play around with for your animal to make sure that they keep eating what you're giving them on their special diets. The first one we're going to talk about is Luna's food. So Luna eats a prescription diet for urinary issues. So if you remember one of the videos before, I talked about how Luna had a procedure to remove bladder stones. Bladder stones, again, are caused by an inability to process certain things in their diet. So before I was feeding her I fed her Iams for a while, and then we switched to like Purina One, and so we fed her that for a while, and then she got her bladder stones. There are ways I think that they can tell exactly what they're not processing, but when I look it up on the internet, it talks about how stones are caused by the inability to break down certain compounds, those compounds with the pH level in their urine, then that causes these tiny crystals to form. So those tiny crystals will also rub against the walls of the bladder and irritate it. So then the bladder will produce mucus to help, cut down that irritation, and then the crystals and the mucus kind of clump up together and form stones. Urinary diets prevent the saturation in the urine to prevent the stones from forming, basically. They also will help with managing the pH level of the urine. The special diet is going to simultaneously prevent stones from forming and break down any ones that are already forming. So urinary diets are huge for animals that are susceptible to bladder stones. So corgis are notorious for urinary issues and bladder stones. Dalmatians are also one. There are smaller breed dogs as well that are just more prone to it. The other big thing that happens is with male cats. So a lot of male cats will have issues with bladder stones and urinary blockages. And so what happens with them is all of that stuff is happening at the same time in a cat's bladder. But with male cats, it will get down into their urethra and actually collect in the urethra. Actually cannot urinate because all of that buildup and sediment from all those stones is actually completely blocking the exit for the urine. So it's a huge deal with male cats, and a lot of vets will recommend male cats being on urinary diets just because they're a male cat. So some male cats will go their whole life without having an issue. And again, it just depends on kind of what diet they're eating and what they themselves individually can break down. It's very, very expensive to unblock a cat, and it can get very serious very quickly. Not only do you have to pay for attempting to unblock the cat, but then you have to pay for getting them to a normal level again. They just crash so quickly that you have to replenish them and all their electrolytes and things like that, and that takes quite a bit of time. And then they might have a recurrence later if you aren't, you know, putting these practices into place of like different diets and things like that. So then you're putting their body through continual surgeries, continual like depletion and replacement of vital nutrients and electrolytes and things like that. So it's very, very hard on them. And so doing something simple like feeding them a different food is really going a long way to prevent any of that. So saving your animal a lot of strife, saving you a lot of emotional distress, and saving money. So there are a bunch of diets that we normally use in shelter medicine. We usually have them on hand all of the time. One of the biggest ones called like urgent care, recovery, AD. So those are usually a pate form, and they're really high fat and high protein. So what you're looking for with these is to be able to give the most amount of calories and the least amount of food. This is a big one that we use, especially for parvo when we're trying to assess diets and trying to get them to eat. You'll see it a lot too with like neonates and things like that, because it's really good for syringe feeding because it's really, really soft and it breaks down easily. We use this a lot when we make like gruel and things like that for syringe feeding, for tube feeding, any of that. So you're really looking for the most amount, like the biggest bang for your buck. It's also, because of the high fat content, it's really palatable. It's more enticing. So a lot of times we will heat it up because it will smell really good, like smell like a really good fatty fast food meal. That is a huge one that we use, and almost every clinic will stock that because of critical cases that might come in that need supplemental feeding. So on the opposite end of the spectrum from that, we have a GI ID kind of diet. So these are low fat, bland, highly digestible foods. So these are really going to help regulate the GI system. They're going to kind of regulate the GI biome and the gut bacteria and all of that. We use this a lot for animals with GI issues where we don't have like a specific cause, or if we're treating a specific cause, we will use it to kind of help the meds go along and help their system just kind of accept the meds and accept the treatment and not stress them with, you know, fatty foods or things that are more difficult to digest. Like when they were normal, they could easily digest them, but since they have this illness or issue, it's more difficult. So we don't want to stress them if we don't have to. Feeding this kind of GI food is going to help digest everything, help them absorb any nutrients they need without making their stomach upset. So another big one is going to be a renal support, kidney diet. A lot of times you'll see it say like KD. These are ones that we mainly use for animals with kidney issues. So either they're in early stages of kidney failure or have impaired kidney function for some reason, whether they got into a toxin or, you know, age, or they have some kind of genetic issue. So we're going to use a kidney diet to help, you know, promote optimal kidney function, basically. So the kidney diets are going to target specific proteins that are going to help with maintaining muscle mass, maintaining energy and strength and all of those things, because especially with chronic kidney disease and things like that, you're really fighting a losing battle in a way. You're trying to preserve as much as you can and lose as little as possible. The kidney diets usually come in a variety of flavors. They usually come in a variety of, you know, loaves versus stews and things like that, because a lot of animals with kidney issues will struggle with eating and struggle with their appetite. So we want to have as many options as possible to make it palatable to them, to keep them eating, to maintain, you know, body mass and strength and muscle and all of that. The other biggest one that we will use is something called hydrolyzed protein. It could also be called select protein, and there are a couple of different flavors of that, but mainly what it is it's a hypoallergenic diet. So a lot of places will use this for animals with known allergies to what is normally in dog food. So chicken is the main one. So if you have an animal with a chicken allergy, you will want to feed them something without chicken, and it's really, really difficult to find not prescription food that doesn't have chicken in it. And I can speak from experience because our dog that we also have is Luna, a while ago we had to say goodbye to her, but we started down a rabbit hole of trying to get her off of chicken because it wasn't bad. Like, she would just chew her front legs. And so one of the vets at work mentioned that when I had brought her in, and she was like, well, you know, she's an Alaskan Malamute, so I guess that might be like a regular thing with them. She mentioned trying to get her off of chicken in her diet, so I had to search high and low for a non-prescription diet that did not have any chicken. So if you read the ingredients of some of these regular dog foods, you will think, oh, this is a salmon diet, but when you read the ingredients, it has chicken livers in it, or it has chicken bone marrow or something crazy in it, and it's like, how can I find a diet that doesn't have chicken when it doesn't say chicken in the, like, you know, description? So it was a long time to find that. So if it's really hydrolyzed protein and select protein, they're more expensive. They're one of the most expensive ones because they have been formulated to really cut out a lot of that, and there are different flavors. So you'll have like a duck and pea or like a venison. So trying to find a not prescription one that meets those needs is hard, but it is doable. We ended up feeding her a Purina One salmon and rice. I think it was sensitive skin and stomach or something that didn't have chicken in it. Hot tip if you're looking for that. The hydrolyzed protein is going to be a good bet for animals that have like anaphylaxis if they come into contact with chicken or something else that's normal in a regular diet. So we'll use it for that. We'll also use it if we don't know what is causing something. So if we think, oh, they keep vomiting after they eat, and we've tried all of these different foods, but nothing is working, like, we'll put them on a select protein to see if the food is the cause. So even though it is a little bit more expensive, shelters will normally keep it in stock because you could have an animal surrender to your shelter that has a severe allergy that you need to have the food for. We just probably won't give it away as freely as some of the other ones, but it is good to have just in case you have an animal that keeps having some kind of allergic reaction or GI upset or something that is not getting better with traditional treatment. So some of the other ones you might see, you'll see more in private practice because we don't really deal with that. Like, sometimes we do need to deal with these issues to that extent, but normally we will go a different route. So one of those is going to be a weight management diet. This is a huge one in private practices because people love their animals and their animals love to eat, which is fine. But if your animal is going to be overweight, they're going to deal with a lot of issues just like humans do when they are overweight. You'll see at weight management ones, obviously, to maintain a healthy weight, and you're going to get kind of a similar thing with the urgent care, but just less fatty. So you're trying to get the most satiation out of the least amount of food. So a lot of them will be like satiety specific, and those are formulated to have a higher satiation rate with a smaller amount of food. And so we don't really use those in the shelter. Instead, what we would normally do is just cut down their feeding. So if someone is feeding an animal 1 cup twice a day, we'll go to like half a cup twice a day or something like that if they need to lose weight. Usually in a shelter too, a lot of them are going to get more walks and more yard time than they might at home. So that's going to help too. But weight management diets can be useful for people who, you know, don't have the time to walk their animals or don't have the time to exercise them, maybe need to cut back on treats or something. There are medical issues where they can be overweight, and then these diets are going to help kind of combat that as well. So another one is going to be a joint care one. There are also some that are called like mobility. They're going to be enriched with these compounds that promote joint health and cartilage strength and things like that. So things like chondroitin and glucosamine, and so they are going to already have those in it, so you don't have to give them another supplement on top of that. Another one I've seen used, not very often, but I've seen it, is a diet called GlycoBalance. There's also another brand that calls it like the metabolic diet, and that is it's just a special diet for animals with diabetes. So it's going to help manage blood glucose throughout the day and keep it more level instead of having it spike every time they eat. So it's not going to spike it as much when they eat, but it is going to get it up enough to where their insulin levels are going to be a little bit more manageable. So again, it's going to promote lean muscle mass, maintaining a healthy weight. I've also read that it has lower starch levels than other diets, so it would be basically like a human going on a low carb diet, but it's already just all mixed for you. The final most frequent one I've seen more in private practice is going to be some kind of dental diet. So there are specific prescription diets for even specific breeds, but a lot of them will just have like a dental specific diet that's going to have kibble that is formulated to help clean the teeth when they eat it. So kibble already acts as like a natural plaque remover, but these have a little bit more of that like higher crunchiness level, and you know, it's all very chemistry forward. I'm not there yet. But yeah, it's going to help promote the removal of plaque and tartar and keeping those teeth clean. And those are going to be really good for people who cannot brush their animals' teeth manually, for animals that are just prone to having teeth issues. So a lot of small dogs and cats are going to just be, you know, more likely to develop teeth issues even with proper care. So having a dental diet is going to help just stave off that as much as possible and keep their teeth as healthy as possible for the longest amount of time. So like I said, there are so many prescription diets out there. I think Royal Canin even has like breed specific ones. So if you have a Frenchie, they have a Frenchie diet. I don't know how much those do. I haven't really looked into them that much. I should maybe kind of do a deep dive. That would be interesting to see what the difference would be, but or what the differences are even in those, because I'd be curious to see what an Alaskan Malamute one is like versus like a Corgi one. There are so many, and it's really difficult to know what you should be feeding or what you shouldn't be feeding, and you know, your vet's going to have all the recommendations for that. Obviously, especially with private vets, they're going to give you the recommendations that are the best case possible scenario. You know, ideally, this is what they would do if they had all the money and all the ability to give your animal the best treatment possible. Now, obviously, prescription diets are really expensive. I think for a big bag of Luna's food that lasts me about 3 months, it's over $100. To me, it's like, I get 3 months worth out of it, but someone with a bigger dog wouldn't. Then you kind of have to weigh that and work it into your budget for certain things. So like I said, for urinary diets, like I don't want to put her through another surgery, so I have to make that work. But a lot of them, it's just like, it would be nice to put them on it, but you don't have to, because there are maybe a supplement, like if you have an animal with arthritis and you can't afford a food, but you can afford the supplements, that's the better way to go. So it's just working with your vet to figure out what the best course of action is for you and your animal. Like I said, for Luna, I kind of have to work that in, because if I can pay $100 every 3 months, or I can pay thousands of dollars for a surgery and put her through difficult healing and run the risk of it happening multiple times more in the future, like I would rather pay $100 every 3 months than like be out like three grand who knows how often. So working with your vet is going to be really the main takeaway here. They're here to help you and your animal and figure out what's best for them. That's within your ability and your wallet size and all of that. So don't let it scare you if they are saying, you know, you need to do this. And there's no other way. You know, second opinions are always good to ask for. Again, there are multiple ways to treat multiple illnesses. So just working with your vet to figure out the best course of action is going to set you up for success. And yeah, I'll tell a little story about it. I got really upset with a vet here that I used to take Luna to, where I would tell her that I would give Luna like one of those little Caesar dishes, like once every couple months, maybe just as a treat. And she got on me for saying like I wasn't sticking to her diet, and that it's really important to stick to her diet because she could just develop bladder stones like that. She was saying all of that while feeding Luna pill pockets, which are not in her diet. Not only are you talking to a tech, but you're telling me that what I'm doing is wrong while you're doing that thing. No. So if you run into something like that, don't be afraid to find other second opinions. That's my little spiel. That is our topic talk for today on special diets, prescription diets. If you have any questions, please feel free to leave them down below. And if you have any recommendations, feel free to leave those for others down below as well. Other than that, thank you for watching, and we'll see you next time.